here to lend her expertise in terms of public policy and politics. Betsy Mccaughey, PhD. She is the chairman of the Committee to Reduce Infectious Disease. Of course, the politician in me remembers when she also served as Lieutenant Governor of New York. She joins us from New York City via telephone. Betsy, thanks very much for your time this morning.
Oh, well, you're quite welcome. And of course, we all hope that the young doctor will do well, that he will recover. But my concern, of course, is for the healthcare workers in hospitals in New York and all across the nation who may be facing the very dangerous challenge of treating a patient with Ebola. It's a real gamble.
And this gamble is seen in the health condition of this young physician. He comes back to New York. Understand he grabs one of the Uber vehicles. He went bowling. Apparently his symptoms were not made manifest until yesterday with an attack of vomiting and diarrhea. And then the protocols were put in place to take him to Bellevue, if memory serves. But I guess my question is this, Betsy. Anybody coming back, healthcare workers, anybody, should they be quarantined for what, a month or at least 21 days?
Well, first of all, he should not have been allowed on the plane. Let's get right to the start here. Doctors and nurses who are very generously, altruistically volunteering to go over to the affected areas of Africa and treat Ebola patients, kudos to them. We're very grateful. But they should not be returning home until they have been quarantined in Africa for 21 days. Because who wants to get on a commercial flight from Brussels to New York and sit next to a doctor or nurse who's been treating Ebola patients?
You raise a very good point, Betsy Mccaughey. And let me call in one of my former colleagues from Congress, Pete Hoekstra of Michigan, who served as the chairman of the House Select Committee on Intelligence. Pete, what Betsy raises here, a quarantine on site for American healthcare workers, flows also into the notion of a travel ban. Why? What is going on? Should there be a travel ban? Why the reticence of this administration to step up for public health?
I'm not sure, JD, exactly why the reticence. You know, the objective right now is, how do you keep a lid on this Ebola issue? How do you keep a lid on it in Africa, where it's going to be much harder to control? But how do you keep a lid on it here in the U.S.? How do they keep a lid on it in Europe? The travel ban, the quarantine of healthcare workers in Africa before they travel back, those seem to be common sense approaches, common sense steps that can be taken to keep the lid on the Ebola crisis. But the administration is just unwilling to take these kinds of steps.
Well, Congress can certainly take them. It's now time for Congress to take these steps to protect the American people. It's not just the president who has this authority. John Boehner could call the House back into session and start right now to enact legislation that will protect us from incoming cases of Ebola. And Doctors Without Borders, a very good organization, should be taking the initiative to quarantine its volunteers before they get on those flights. You asked a moment ago, why the reticence? Well, President Obama seems to have a very close relationship with Ellen Johnson Sirleaf, the president of Liberia. She's got him on speed dial, and those two Nobel laureates who are so buddy-buddy are unfortunately putting their commitment to Africa ahead of the safety of Americans. That's not the president's job. He should be looking out for us first.
I disagree with the assessment, JD, that this can be run out of Congress. Number one, it has to be run out of the administration. Sure, John Boehner can call the House back. He may be able to get something done, but they're going to run into exactly the same thing that they've run in for the last 4 years. The House may take steps. They might actually agree with that strategy, and then they're going to run smack dab into the Democrats and Harry Reid in the U.S. Senate, and it's not going anywhere.
Let me explain why. Any Democrat running for re-election this year is not going to vote against that travel ban.
Well, that's an interesting point, Betsy. It certainly seems to be that there is overwhelming support for a travel ban. Yet you get into a situation, Pete, and I think it speaks volumes. We're taking a look at this, and the Senate has Ebola hearings scheduled, of course, after the midterm elections. So this is an intersection of policy and politics that may in fact affect public health. Betsy, one other question for you, because you were talking about your concern for health care workers.
Of course, in America, most Americans are not at risk of catching Ebola, but healthcare workers are at tremendous risk. How can hospitals that are unable to stop the spread of staph, C. diff, and other common infections killing 75,000 people a year in our hospitals, if they can't stop staph and C. diff, they can't control Ebola?
Very good point, Betsy. Let me turn to Pete with a couple of minutes left here. Pete, we've been so afraid of weaponizing something like Ebola. It seems that just what appears to be nothing nefarious other than neglect or an unwillingness to take common sense steps has jeopardized at least healthcare workers and maybe a whole lot more Americans. But what about the specter of weaponizing something like Ebola?
Well, I think as you take a look at what's going on right now with ISIS, and our response to it, again, it's half-hearted steps to control ISIS in the Middle East, half-hearted steps to control these people who become radicalized on the internet. ISIS is very creative. It's the radical movement. They are very creative. It doesn't take much creativity to say, let's take a few people, let's get them infected, or let's go into these countries, let's get some of the fluids, and let's get them into the United States and release it. It's something that I think this president and the country ought to be very, very concerned about. We see the response, in New York and Dallas and that, to these lone wolf attacks. Just think of what the impact would be if it became clear that ISIS had taken the Ebola virus, human fluids, and was distributing them or making them available in public places in the United States.
Fair enough. Last word. Let me get to Betsy. Betsy, 30 seconds. Your biggest concern right now is
my biggest concern is the healthcare workers. I hear Andrew Cuomo and the president and Tom Frieden say we're getting these healthcare workers ready. That's like saying to me, you want to play piano at Carnegie Hall? We'll give you 3 days and get you ready. It's not possible to train people in such a short period of time for such a dangerous job.
Betsy Mccaughey, we thank you for your insights. Peter Hoekstra, former chairman of the House Intelligence Committee, we thank you for Skyping in from Washington, D.C. And America's Forum will continue following this Newsmax Now update.